Okay, so we're here in Jamaica and we're doing some dental extractions in our little clinic here. We're going to get a little teaching video here on how to remove a decayed tooth.
We're getting ready to extract tooth number 29. It's got distal decay and the tooth is abscessed and it hurts her when she eats.
You're doing an inferior alveolar nerve block?
We're using lidocaine 2% with epinephrine 1 to 100,000.
Okay.
And I'm going to use 2 carpules. It's a pretty large nerve, and I generally always use 2 carpules. What we're trying to do is demonstrate how much of the tooth is gone because of the decay in the distal of the tooth.
So tell us a little bit about the basic equipment if we were going to pull some teeth.
We start off with the periosteal, and what the periosteal does is remove the gum tissue away from the tooth.
Okay.
Then
so you just kind of slowly pry away the gum tissue from the tooth.
To expose the roots of the tooth.
And you do that so that when you pull the tooth that you don't tear the gum.
Exactly.
Okay.
Exactly.
All right.
And then we go to a small straight, and what the small straight does is kind of pushes the tooth from side to side to loosen it up.
Okay.
Okay, and we can use a small straight, a medium, and a large.
So are you basically lifting the tooth?
We're lifting the tooth with the straights.
Okay.
Yes,
and are
sir.
you doing a twisting motion as
We are doing a twisting motion.
Okay.
We go in between, and then we'll rotate it for the tooth. So this goes up, grabs it at the root, and lifts it up.
Okay. All right.
And then this is our forceps. This is what we actually use to grab the tooth. And what we do is we push it as far below the gum line as we can to grab the roots to pull it. And then we move it back and forth until it loosens up.
Okay. So rotating back and forth, do you do it differently for different type teeth?
We do it the same way for all teeth when we extract. Yes.
Okay.
We would do back and forth, and then we can even do in a circular.
A rotatory.
Rotate from side to side and back and forth.
Excellent.
Until it loosens up.
Okay.
In the video, you could see how the distal of the tooth was almost totally destroyed because of the decay. So I don't want to put any pressure back here on the distal because it's very fragile. So I'm going to put most of my pressure on the mesial because that's so much sounder tooth structure. Now the first thing that I'm going to do is separate the gum tissue, the gingiva, from the tooth itself. So I'm severing the periodontal attachment, both on the facial and the lingual of the tooth. The next instrument I'm going to use is a straight elevator, and I'm going to put it in on the mesial of the tooth, and I'm going to start to put some pressure on it until the tooth starts to get some mobility. I apply just a real steady pressure, and what that does is that pops a lot of those little periodontal ligaments that attach the tooth to the bone, because it's so important to get the mobility of the tooth first before you put the forceps on it and try to remove the tooth.
So you're just doing steady upward pressure? Is that what you're doing?
Because the elevator is curved, it's got a concave surface, and so when I rotate it, what I'm doing is actually elevating it up in the socket. The root of this tooth is more conical shaped, so it's actually lifting the tooth up, and you can see the blood that's coming out of the sulcus around the tooth.
Yes.
And that means that a lot of those little ligaments have already popped, and I've got good mobility starting with that tooth. Now, the next thing that I'm going to do is put the forceps on the tooth, and I'm trying to get the forceps down as far as I can on the root of the tooth so that I get the fulcrum down as low as possible, and I start a gentle rotation movement, and the tooth starts to get loose,
There you go.
and then it comes out. And
You get a
see
close
the
up.
socket. And if you flip it over on the other This is all the decay on this side. And the decay is going all the way down to the pulp chamber and to where the nerve of the tooth is, and that's why the tooth is abscessing.
Okay.
Now the next thing that I do is, I'll compress the socket because we've expanded the buccal and lingual bone.
So how much pressure are you putting on when you're compressing the socket like that?
It's a fair amount of pressure, and then until it feels pretty smooth there.
Okay.
That's compressed, and it's not going to compress anymore.
So what percentage of these patients may end up getting a dry socket?
Bite together. Probably 15 to 20%.
You can set up.
Okay.